Thank you. So, good afternoon, everyone. I am here to talk about the metabolic theory of mental illness. And yes, it is that bold and audacious, and some of you might think stupid of me to say. So, I actually have no disclosures, and I've gone out of my way to prevent disclosures. I've been asked to consult to commercial entities, biotech companies, startups, and others, and I'm actually declining all of them because I want to maintain as much credibility as possible and let people know that I'm not in this for the money. This really is a bold and audacious theory. And so I want to quote somebody who also proposed a bold and audacious theory, Albert Einstein. Creating a new theory is not like destroying an old barn and erecting a skyscraper in its place. It is rather like climbing a mountain, gaining new and wider views, discovering unexpected connections between our starting point and its rich environment. But the point from which we started out still exists and can be seen, although it appears smaller and forms a tiny bit of a part of our broad view gained by the mastery of the obstacles on our adventurous way up. Where we start still exists. Pills can help mental illness. Psychotherapy can help mental illness. Electroconvulsive therapy can help mental illness. Those facts still exist with the brain energy theory. Those treatments harm some people. Those facts still exist within the brain energy theory. So with that, I invite you to climb a mountain with me. And as we start climbing this mountain, we look out on the landscape and we see a crisis in the world today. Prior to the pandemic, mental and substance use disorders affected about 1 billion people on the planet. Rates are even higher now. Mental disorders are now the leading causes of disease, burden, and disability in the United States and throughout the world. The problem is not access to care, although that is a problem. The problem is that our treatments fail to work for far too many people. Why can't we do better? What's the problem? The problem is that nobody can answer this fairly simple question. What exactly causes mental illness? All we know are risk factors. And these risk factors get lumped into the biopsychosocial model. We say that there are biological factors, things like neurotransmitters, genetics, hormones, and inflammation. There are psychological and social factors, things like trauma, neglect, poverty, loneliness, that all come together to cause mental illness in different people in different ways, around different diagnoses. But how do these fit together? Nobody knows. Now I want to climb this mountain a little more so that maybe we can start to get some perspective on that question and the answers that can maybe broaden our view and lead to new treatments. And I want to start with correlations. Correlations don't prove causation, but we have very strong correlational evidence, decades if not centuries of this evidence, linking what we call mental illness with all of the disorders on the right-hand side of this slide. Obesity, diabetes, cardiovascular disease, Alzheimer's disease, and epilepsy. For example, people with chronic serious mental disorders, 2 to 3 times the rates of obesity and diabetes. People with mental illnesses, higher rates of cardiovascular disease. People with depression, about twice as likely to develop Alzheimer's disease. But get this, if you have schizophrenia and live to the relatively young age of 66, you are 20 times more likely to also be diagnosed with Alzheimer's disease or dementia on top of your schizophrenia, 20 times. People with mental disorders are more likely to develop seizures. Elderly people with depression, 6 times more likely than others. to develop an unprovoked seizure. But what if we look at it the other way around? People with obesity, 25 to 75% more likely to have a mental illness. People with diabetes, twice as likely to have depression when that depression occurs. It lasts 4 times longer than it does in people without diabetes. Cardiovascular disease, 3 to 5 times the rates of depression. Alzheimer's disease, almost 100% of Alzheimer's patients will have mental symptoms. Depression, anxiety, agitation, insomnia. 40 to 50% of them will have hallucinations and delusions. These are the hallmark symptoms of what we call schizophrenia. So think about it. If you have schizophrenia, you're 20 times more likely to get Alzheimer's disease by the age of 66. And if you have Alzheimer's disease, there's a 50-50 chance you're going to develop the hallmark symptoms of schizophrenia. We cannot talk about root causes of mental illness without talking about root causes of these other disorders. And in fact, people with mental disorders are aging prematurely and dying early deaths. It has long been known that people with chronic serious mental disorders like chronic depression, bipolar disorder, and schizophrenia have a shortened lifespan, anywhere from 7 to 30 years of lifespan reduction, depending on what study you look at. But in fact, a recent study published in Lancet of a population of over 7 million people tells us something more dire. All of the mental disorders are associated with increased risk of shortened lifespan. This includes ADHD, personality disorders, mild anxiety disorders, depression, all of them. What are they dying of? What are these mentally ill people dying of? Everybody thinks suicide. Oh, those crazy people must be killing themselves. Well, yes, the mentally ill do have higher suicide rates, but in fact, that's not the primary cause of death. They are primarily dying of heart attacks and strokes and diabetes and Alzheimer's disease, but just at a younger age. Why? This hasn't gone unnoticed, folks. World Health Organization issued a report in 2016 to try to answer this question. Why? 1, factors related to the individual's behavior and or his or her disorder. The mentally ill are overeating and under-exercising. It's those pills that we're prescribing. They cause weight gain. So maybe it's not all their fault. But if they tried hard, they would be able to keep the weight off. Problems at the health system level. The mentally ill don't go to their primary care docs and take their statins like good patients should. Wider societal issues. The mentally ill are more likely to be unemployed and poor. And we know that unemployed, poor people live shorter lives on average. So maybe it's just that. At the end of the day, if you really look at these and think about them, it's about blaming the victims. The mentally ill are lazy slobs. They overeat, they under-exercise, and they don't work. They're poor, and they don't go to their doctors like they should, like responsible citizens should. It's their fault. I am here to offer a better answer based on science. I am here to say that mental disorders are in fact metabolic disorders of the brain. And in fact, this is nothing new. This is not about inventing a new theory out of thin air. This is about integrating over a century of scientific evidence. Clinical, epidemiological, basic science, genetic research, neuroimaging research, all of it. When we put it all together, it becomes undeniable that mental disorders are in fact metabolic disorders of the brain. Basic research dates to the 1940s. Diagnoses include depression, anxiety, PTSD, schizophrenia, bipolar, anorexia, alcohol use disorder. What do I mean when I say metabolic problem? I have to go beyond insulin resistance. It's more than insulin resistance. It's about changes in lactate, glucose metabolism. So yes, insulin resistance is part of this, but it's not the whole story. Levels of ATP to ADP in cells, levels of reactive oxygen species, redox markers, levels of NAD to NADH, inflammation, cortisol, brain insulin, and mitochondrial function. And I will talk more about that in a bit. Now, well, a lot of people are arguing, but wait, Chris, you know, it's the pills. It's the pills. The pills are toxin. The pills are toxic. The pills are absolutely adding insult to injury. But this longitudinal study of over 5,000 children tells a different story. Followed the kids from birth to age 24. Those with the highest levels of insulin resistance, beginning at age 9, were 5 times more likely, that's 500% more likely to have a psychosis at risk mental state, and 3 times more likely to already be diagnosed with a psychotic disorder. That means bipolar disorder and schizophrenia. So the metabolic problem comes first, and then the mental problem comes next in some people, not all people. Children who gained the most weight around the time of puberty were 4 times more likely to develop clinical depression. I am here to try to integrate the mental health field and the metabolic health field. Both have something to learn from this theory. I am arguing that mental health and metabolic health are one and the same, and they are in a feedback cycle with each other. When we think about mental, we think about neurotransmitters, stress, adverse childhood events, trauma, loneliness. Those are mental things. Those are in your head. When we think about metabolic, well, that's just diet and exercise. If everybody follows the right diet, debate amongst yourselves about what the right diet is, low carb, keto, carnivore, vegan, whatever. If people follow the right diet and they exercise, they're not going to have a metabolic problem. Well, neither one's quite so simple, because we know that genetics and epigenetics can play a role, hormones can play a role, inflammation, sleep, gut microbiome can play a role. And what I'm here to argue is that adverse childhood events can cause obesity and heart attacks, and that diet and exercise can cause the brain to malfunction in ways that we end up labeling mental illness. So I'm saying metabolism, metabolic. What is metabolism? It's a lot more than burning calories, and it's more than just metabolic syndrome. It's more than insulin resistance. It's more than obesity and diabetes and cardiovascular disease. It is the process that all living organisms use to convert food into energy or building blocks that are used to maintain or grow cells, and it also includes the management of waste products. Metabolism is fundamental to the definition of life. It is extraordinarily complicated, as illustrated by this actually fairly simplistic metabolic diagram. So metabolism is everything. So what, Chris Palmer? You're saying it's metabolism? Well, what the hell does that tell us? That's just kind of, you're just saying mental disorders exist in the universe then. Big deal. So what? Well, when we ask the question, what controls metabolism in the human body, we actually start to get some useful information. I am here to argue that the single factor most important in metabolism are mitochondria. Most people know mitochondria as the powerhouse of the cell, but I'm here to tell you they are so much more than that. This is an area of cutting-edge research in the entire medical field, spanning numerous disciplines: metabolic health, aging field, cancer and oncology, and mental health and neuroscience. They are critical players in metabolism. There are hundreds or thousands of them in each cell. They are highly dynamic. They are not just little stationary powerhouses. They are moving around cells, fusing with each other, budding off from each other. And in fact, when you do a deep dive into the science of mitochondria, they are the unifying link of all of the risk factors that we know about mental illness. They play a direct role in the production and regulation of key neurotransmitters like dopamine, serotonin, GABA, and glutamate. They play a powerful role in epigenetics, and that means the expression of genes in the cell nucleus. They play an instrumental role in the production of some key hormones such as cortisol, testosterone, estrogen, and progesterone. They are affected by and/or affect sleep, drugs and alcohol, trauma, stress, adverse childhood events, exercise, diet, gut microbiome, inflammation. Mitochondria are sensors of our environment, and they respond to our environment. And that includes diet, absolutely, but it includes sleep and stress, psychological stress. So what causes mental illness? I am here to argue that mental disorders are in fact metabolic, are due to metabolic and mitochondrial dysfunction or dysregulation. These mean slightly different things. This is the best, most accurate nutshell I could come up with. And again, I just want to iterate, this is nothing new. 1879, diabetes is a disease that often shows itself in families in which insanity prevails. The 1930s to the 1960s, within 10 years of the discovery of the insulin molecule, we were injecting insulin into the mentally ill because scientists and psychiatrists knew about these connections then. And they desperately wanted to help the mentally ill, and they recognized they've got a metabolic problem. There's something to do with diabetes, and these mentally ill people, maybe they need more insulin. Abnormalities in lactate metabolism have been identified in people with bipolar disorder and schizophrenia since the 1940s. The mitochondrial theory of autism, 1985. All of those imaging studies that we're doing, PET scans, functional MRI, SPECT scans, what are they measuring? They're measuring brain metabolism. The mitochondrial theory of bipolar disorder, 2000. And since then, numerous theories of mitochondrial dysfunction or the role of mitochondria and mitochondrial health in numerous mental disorders. Much more important than an abstract theory or connecting the science is, well, what the hell can we do? How can we help people now? The great news is there are many metabolic treatment strategies available today. These are not going to fix and cure every single human being who's got a brain disorder. Metabolism is complex, but these are going to fix and help put into remission a lot of people, because I am seeing it right and left. Diet, exercise, sleep, the gut microbiome, managing substance use, tobacco, alcohol, marijuana, stress reduction, hormonal imbalances. You're all like, yeah, those are kind of standard health and wellness things. That's the point. I want to point out all of the psychiatric treatments that we have can be tied directly to an effect on mitochondria and metabolism. Some of them are helpful, and some of them are harmful. Let me go through just a couple of these. So, does exercise treat mental health? Well, we know that exercise can help prevent mental problems. So this large population study of over 1 million people finds a correlation. Those who exercise regularly have better mental health. The challenge with this kind of correlational study is it could be reverse causation, meaning those who are already mentally ill don't have the energy or motivation to exercise, and those who are mentally healthy do. So maybe it's just circular logic. But exercise is known to improve metabolic health, so why wouldn't it work on its own? We know from weight loss studies and diabetes studies, exercise as a solitary intervention is not very effective for metabolic health. Having a type 2 diabetic exercise and nothing more often does not reverse that diabetes. It doesn't often usually even result in sustained weight loss. Data on mental health outcomes are primarily from small, poorly controlled trials. One meta-analysis of exercise for depression actually found no effect whatsoever. Similar to the weight loss studies, exercise for weight loss is not very effective. But the World Health Organization begs to differ, and they actually say they reviewed the evidence, and they say physical activity is good for people with depression, schizophrenia, and dementia. And then Dr. Scher, for those of you who are here this morning, already reviewed some of the evidence for the ketogenic diet. For those of you who don't know, you know the ketogenic diet, I'm going to assume that. It mimics the fasting state. It is an evidence-based treatment. It is not a fad diet. It is an evidence-based treatment. Numerous randomized controlled trials for weight loss, type 2 diabetes, and epilepsy. And as a psychiatrist, I am most interested in that last one because we use epilepsy treatments in psychiatry every day in tens of millions of people. The ketogenic diet is a metabolic intervention, as Dr. Scher said, not a diet. Or we shouldn't think about it as a diet when we're using it to treat a brain disorder. It can be a diet. It can help you lose weight. I'm not here to disclaim any of that. I've been there, done that myself. So I get it, but it's more than just a diet. And we've got emerging research suggesting its efficacy in patients with serious mental disorders. Well, how the hell would a diet do that? We know more about this diet and its effects on the brain than we do any other dietary intervention because biotech companies, neurologists, neuroscientists have been studying this for decades, trying to figure out how the hell does a diet stop seizures when Depakote doesn't? How does it stop seizures when all of our best medications don't? They're looking for new targets. So we actually know a tremendous amount, and guess what? All of this is highly relevant to the mental health field. I'm going to call your attention right in the middle of that slide. This diet stimulates two things relevant to mitochondria. It stimulates mitochondrial repair, or something called mitophagy, and it stimulates the production of more mitochondria, something called mitochondrial biogenesis. And I am arguing that it is those effects, more than the improvement in insulin signaling, more than the changes in neurotransmitters and calcium regulation and gut microbiome changes and everything else. I am arguing that the changes in mitochondrial function and health and density are the primary mechanism of action in healing people with brain disorders. But does it work? Well, we have a growing body of literature. Yes, it's in its infancy still, but it is growing. You've already heard, for those of you who heard Dr. Scher, you've heard about the 31 inpatients who got admitted to the French hospital. Treatment-resistant bipolar disorder, depression, and schizophrenia, 64% were discharged on less medicine, 100% had improvement in symptoms, and 43% achieved remission. That doesn't happen with the best treatments that we have to offer. And in fact, these first two case reports that I list are patients who had schizophrenia for 20 years and 53 years. And they both achieved long-lasting remission of illness off antipsychotic medications using a ketogenic diet. So where do we go from here? There are numerous researchers advancing this field. This is not Chris Palmer's theory. Again, I'm collecting decades of neuroscience, metabolic research. Numerous researchers are still pursuing this. Due to generous philanthropy from the Bazuki family, we now have the Bazuki Brain Research Fund and the Metabolic Psychiatry Group. Dozens of neurologists, basic scientists, psychiatrists, mitochondrial and metabolism experts are collaborating. We have at least 5 controlled trials of the ketogenic diet for serious mental illness underway. We have other trials of the ketogenic diet for depression, post-traumatic stress disorder, alcohol use disorder, Alzheimer's disease, and others. But where do we really go from here? Do you hear about this today and leave here, and that's the end of it? So I will tell you, as a psychiatrist who has faced people with serious chronic mental illness for 27 years and talked to their family members and had people crying in my office, begging me for better treatments, willing to shock their brain with electricity in the desperate hope to get better, willing to get brain surgery in the desperate hope to get better. I am telling you, they need better answers, and they need to know about this research. And so I am calling on each and every one of you to please, if you care about this, please get involved. We need a grassroots movement. We need people telling others about the brain energy theory or the metabolic theory of mental illness and the treatments that it offers today, but also the requirement that we have more research funding for this. Right now, mental health research gets 4% of the global research dollars. 4%. Even though it is the leading cause of disease burden and disability on this planet. These people are blamed and stigmatized and shamed and just told, accept a second-class life. You don't deserve any better. You're just nothing. You're no one. And on behalf of all of those people, I am asking you to please help. You can go to brainenergy.com. You can sign up for our newsletter. You can email us and let us know if you want to help in any other way. Thank you.